Welcome to Healthy Pets, Healthy Owners. I'm Dr. Edmund Sulkowski, and we have a fantastic show for you today. Our topic today is Stem Cells 101, Nature's Miracle. You know, we're very fortunate in the Pittsburgh area. We have some wonderful hospitals. I mean, people come from all over the world to come to our hospitals for medical procedures, for surgeries, for diagnostic care. But you know, we have an extra special person living in the Pittsburgh area. In fact, in Peters Township, you know, how lucky can we be? We have Dr. Dennis Courtney from the Courtney Medical Group today, and we are talking stem cells. My friend Dennis, welcome back to Healthy Pets, Healthy
Hello, Dr. Edmund.
You know, Tucker and I always enjoy having a conversation with you, and I try to bring you back on this show as often as I can, and on my radio show, Healthy Pets, Healthy People, on AM 1250, because you are an educator first. And we're going to talk about stem cells today and your eye protocol, and I think it's so important for people to understand what we can do as individuals, as people, as patients, to prevent going to these wonderful hospitals that we have here. Because I always say that surgery is a last resort. So, Dr. Courtney, I know your background very well. I would like you to tell our audience a little bit about yourself. First of all, before you became a physician, what was your profession?
Now, there were many professions, but I hearken myself back to the first of my professions. I'm a high school teacher. I'm a teacher that actually did teach in the suburbs of Pittsburgh for about 7 years. I enjoyed that job immensely. I left the classroom, the formal classroom, but my office practice has turned into my classroom, so that every single day as I meet patients, I'm teaching from the moment I meet them to the time they leave. To have this ability, I think it is a unique one, to take very difficult concepts and simplify them to the point where they're easily understood. So that worked well for a group of sophomores in high school for years, and that certainly works well for the general public, because as they come to me with their medical issues, they truly don't understand them. And once they do appreciate them and understand them, they literally become a participant in the treatment of it and correcting it.
And that's what you and I term as empowering, and that's what education is. You take a novice at something who doesn't have the knowledge on a particular topic, you become educated, and then you flower and you prosper and you grow. And you do that. What was the impetus for you to go from being a professional educator in the classroom and becoming a physician?
That question hasn't been asked of me for a long time. I'll try to shorten that answer, just have to say that I was pulled in as a teacher into the medical arena by a wonderful doctor, Dr. Claire Jean Ursaws, who was the medical director at St. Clair Hospital. At the time, she was not the director. She was the one who ran the ICU unit there at the hospital. And she was involved with establishing ambulance services at that time. You know, our old ambulance services was a station wagon with a cot in the back. And that transition that we have made from that to what we have now all occurred in that era with her help, and she enlisted me for that help.
I know that story. You had a big part in starting this ambulance, which went national. Today, it was locally just in Pittsburgh.
It started here in Pittsburgh with a group from the Hill District called Freedom House Ambulance. These were a group of people who Dr. Peter Saffer, a very famous anesthesiologist from the University of Pittsburgh, felt, I wonder if we could take the emergency room to the patient as opposed to what was happening, which was driving at ungodly speeds to get the patient to the emergency room, but no care was being delivered in the back of that station wagon. It was a station wagon with a cot and a bottle of oxygen. That was it.
And sometimes even funeral directors would transport people from their home to the hospital.
It was a sorry system.
Yeah.
What we have now is very encouraging to know that it played a role in that.
Well, you actually created a whole new part of creating a whole new industry. That's really what it's become.
Well, Edmund, what I had to do was sit down across from mayors and council members and I would speak with the authority of Dr. Clara Jean Arisoz, and they would say, well, who are you? And I go, well, I'm Dennis Courtney. Well, what do you do? Well, I'm a teacher. That didn't go well. And oftentimes I had to call Dr. Arisoz while I was in front of the mayor or in front of the city council and say, look, I'm having a little trouble with him. You know what I mean by that, Dr. Arisoz? And she said, pass me the phone. And so she, a sense, I don't know what she actually said, but was, you better listen to that guy. I sent him there for a reason. I'm working with doctors in and around them all the time, and I just reached a point where I said, I think I can do this.
So you didn't come from a medical family of any kind?
No.
And so I came from a family that was in dentistry, and it sort of was just something I knew and was
it was
comfortable
expected
with. And
you
it was
should
kind
move.
of expected, you know. But the interesting thing, what people don't realize, us who have doctor degrees of one or kind of another are actually defined as educators. That's what the term doctor means. And so you've never really left that classroom education, and you do that on shows such as Healthy Pets, Healthy Owners. You do it on the radio show. I mean, I could have you on every other week actually on my radio show because we have such good rapport and a great way of disseminating information to help people, and that's what that show's all about. And but you do this also in your as lectures and so forth, as I do. We love to get out in front of people and talk and empower them, and we use that word all the time when you and I are talking, but it's a word you used yourself and I used myself without ever having a discussion. Let's use that word empowering, because that is really, education is taking charge and being in charge.
Sure. The public, once they're made aware of the particular issues that they're involved with their own health, and they fully understand the degenerative nature of their situation, remember the kind of medicine that we practice is we literally correct the problem. We're not using drugs to try to mask the symptoms of that problem.
Suppression of the symptoms.
That is, unfortunately, I believe, an incorrect way to approach it. And I don't use drugs in my practice. So we're working on trying to reverse these disorders so that with the disorder as it's reversing, the symptoms are alleviated and ultimately are gone.
And that's kind of what medicine has become. It's become what I call Frankenstein medicine. I coined that 25 years ago. And the way I looked at it was, and it really came to me because of what had happened to me with my medical issue 26 years ago. When you see somebody in the medical profession, the result is usually a surgery, a sewing back together, or a suppression. And that's kind of how they made Frankenstein, you know. So what you do, and I always say you're a little bit out of the box like myself, but that's kind of a funny term. But really what you're doing is looking at the root cause, where in general, when you go to any physician, they're not looking at the root cause. If you have high blood pressure, they don't say, oh, why do you have high blood pressure? They say, oh, I got a pill for that.
That's right.
Your supposedly cholesterol is high. Well, why is your cholesterol high? That's never asked. It's, I got a pill for that, right? You're doing this, and my approach to all of this is, and I think dentistry and actually chiropractic care was in the forefront of this. Why do you have this? You know, why do you have tooth decay? Why are you walking funny? Why do you have pain down your leg? Let's see what the root cause of it is and try to reverse that. And that's specifically what you've done over the years. How many years as a physician?
Over 30 years now.
And you've done that pretty much from the get-go. It wasn't a cut me, bill me, you know, pill me, you know, see ya. And you know, the interesting thing is there was a generation of people that thought physicians to be gods, doctor gods. You know, my doctor says. Well, now people are educated and they're responding, well, why is my doctor telling me to do this? Why do I need to be on this pill? What can I do to change it? And I think because, and there are a number of people around this country that are doing it, and in Europe, that have the same approach that you do. Let's find the root, change that root, reverse it, and let the body heal itself.
The public is really spooked now. Ever since, I think it dates back to when the FDA allowed you to advertise for medicines, prescription medicines on television. because I don't think there's a person who'd be listening to us today that isn't aware of that last commercial last night that brought some prescription medicine into their living room. In the last 10 seconds, we all know about the last 10 seconds of these commercials, where essentially your leg can fall off and you can drop dead on the way to the refrigerator, but as one of the potential side effects.
But ask your doctor for that medication, though.
So the public really, it was always possible. Back in the day, patients would think, well, my doctor would never do that to me. No, I trust my doctor to make certain that he wouldn't harm me. Well, we, and you and I know that prescription medicines are the third leading cause of death every year. Number 3, that's when the drug was prescribed appropriately and taken appropriately, but it's our third leading cause of death. Now, this just can't be. We can't permit this.
And on top of that, there is no medication out there that cures anything.
No, they're all suppressing symptoms alone, and in a sense, taking away the body's what was talking to you. Maybe it was screaming at you with a symptom that was so bothersome, but if you can shut that off, unfortunately, the patient is pleased, thinks that their doctor is some sort of a messiah, helping them and alleviate the symptom, when in fact, that symptom is going to rear its head on another day, and the next time it does surface, it's going to be more devastating than the last time, and there'll ultimately be a time when there won't be a medicine to suppress that symptom anymore, because the disease will be so far out of hand that there won't be any medicines to reach.
And that happens with the use of antibiotics and painkillers and the problems that those things occur. I mean, every day when I go on some medical site, I see where there's a strain-resistant this and an outbreak of this because the medication that's been used in the past isn't working any longer and it's resistant and so forth. So there are problems created all along with this. When you take this approach where we're looking at the root cause, you're kind of short-circuiting all of that, supporting the body to then heal itself. That's basically what's happening. So I want to review some diseases with you. So for example, I have pain in my right knee, and I go to a physician, and he says, well, you have arthritis. What is arthritis?
Mm-hmm. Well, the joint disease, and in particular inflammatory joint disease, is a common issue to be found with people of advancing age. The way I see it, just about all of us as we advance in age get some form of arthritis or an inflammation of the joint, and the joints that end up presenting themselves to me are number 1, the knee, number 2, the hip, and number 3, the shoulder.
So these degenerative diseases that we term arthritis, that's a deterioration of that joint?
Yes, it starts in very mild sense. The symptoms are equally mild, but this is a progressive and advancing disease. These usually come under the scrutiny of our orthopedic surgeons, orthopedic personnel, very brilliant people with very unbelievably potent skill sets. But ultimately, everybody knows that at the end of the line here, the last step that orthopod is going to be using to help in this regard, your knee, is going to be recommending that you replace that knee with an artificial joint. And don't be showing up too early for that, by the way. Let's say you were in your 50s and your knee is bothering you. This is way too soon to have the joint.
Why?
Because the artificial joint that would be put in its place can't hold up for 20 and 30 years.
Average life?
We're well into the 70s now, and we're going to hopefully go higher.
So the artificial joint lasts maybe 5-7 years?
You cannot be putting these in early on. You're going to have to make it to your 60s at least.
So on average, those joints, you can have 2 surgeries?
They have to do redos. They do not like doing redos. They are more problematic. They're more associated with sequel and side effects and repercussions that they'd like to avoid. But if the joint breaks down, it's going to have to be replaced.
So when you talk about a degenerative disease, and let's focus right on the knee, and we term a general term arthritis. So that's an inflammatory response that our body's making because there's something wrong there. And some inflammation is good. We would die if we didn't have inflammation, but too much inflammation is bad for us. So it actually begins to cause the bone to go away, the cartilage to go away.
This is a degenerative joint disease. The anatomy of that joint is changing from the day these processes begin, and they never turn back. It's not as though you only have arthritis for a little while and then it gets better. No, at the beginning of arthritis, your symptoms may be minimal, but it will be progressive, and it will continue to advance. How rapidly that advancement occurs is what changes. Some, that happens very quickly. Others, it does not. But it is moving south, and we know south is not good, and ultimately it will culminate in the recommendation of a joint replacement. This is the way things have been done, and by the way, continue to be done. What I've learned since being involved in stem cells is that those surgeries, in my opinion, is from what I've seen, are completely obsolete. I believe that the public, as they become more aware that there is something that can be done instead of a joint replacement, will move toward it when they feel more comfortable about it. But I feel wonderful about being involved with stem cells because of the miraculous turnarounds that I see in people who were literally scheduled to have that surgery next week. But because it was a critical time, they had to make a decision. They were frightened about going to have the surgery.
And fear's a big factor.
And because the surgery could actually be done perfectly well. But some people don't leave the hospital because some untoward event might very well
like
end up in their demise. Infections, you name it. So you can understand why someone who has themselves on the schedule to have a surgery done, if there's another way that they could avoid that, they look toward it.
Well, when you talk about these diseases that occur in arthritis, is that guaranteed because you're just getting older, or is it due to injury, or someone who is not eating properly or has hormonal problems?
Look, the degenerative joint diseases that one's experience, usually in our earlier years, unless we're athletes and injure ourselves, because injury is usually the initiator of someone's long-term problem. But barring that, the inflammation of a joint just occurs with overuse and disuse and the abuses of
overuse, disuse, and misuse.
Of what we do.
Yeah.
We walk the planet, we run on the planet, we jog on the planet, and
wear incorrect shoes.
And of course, the form of arthritis that's most common is this wear and tear. Another term frequently uses bone-on-bone forms of arthritis.
What are the two most prominent forms of arthritis?
Well, there's osteoarthritis, which is the most common by far, where it is a degeneration over time of overuse. There's another form of arthritis that is much less common. That's a rheumatoid form of arthritis. In this particular case, this is an autoimmune disease where a person's immune system literally attacks a joint relentlessly. And because of that assault every day, causes further inflammation and further degeneration.
So regardless of whether it's a knee joint, a hip joint, shoulder joint, or jaw joint for that matter, they're all the same. So that actually, with rheumatoid, works against you because it's an encapsulated area. So everything that's in there is locked, and that degenerative process is kind of held captive. But stem cells actually use that same process to regenerate that joint. So explain to us what a joint is comprised of, and then we're going to go into what a stem cell is after that.
Well, the knee is a good example. So we've got this structure here with two bones that meet, one large bone up top, and that's called the femur. that comes to rest on the tibial plateau, the tibia underneath it. There's cartilage in between these two bones. Fancy word in the knee, that's called meniscus. There's a membrane that surrounds the bone called the synovium, literally producing a lubricant. And then finally, ligaments and tendons that strap the joint together that allow us movement. So no matter what joint you can name, those 5 tissues are what comprise that joint, and whatever joint we're talking about, whether that be knee, hip, shoulder, finger, spine, same 5 components. Now, in the case of these joints, there's also a capsule that surrounds the joint that we can enter with a syringe, with a needle, penetrate the capsule and deposit stem cells into the capsule in between those 2 bones. These stem cells, which we can harvest, the primary source of them is newly delivered babies by scheduled C-section.
That sounds a little strange. And I just want to clarify this because I know you're on this role of where we get the stem cells from. And it's interesting because it's not taking from the babies, it's taking from what's discarded, the afterbirth.
That's right. So a mom who's pregnant says, she raises her hand and she says, I'd like to make a donation to medical science.
So she receives no financial compensation.
She cannot receive not even $1 for that donation because that would be an incentive to lie. So no, she makes that pledge. The moment she makes it, then the companies dispatch people to visit with her, to have an interview with her to find out about maternal health issues. They really need to be certain that the mom doesn't have a maternal health issue that could be transmitted through her baby cells.
What would be some examples of a issue?
A lifestyle, sexual
drug
orientation,
use.
All sorts of issues would be a red flag that this would not be a proper source.
So those are eliminated through that process?
Right off the bat. If you pass the first level of scrutiny, then you undergo a second level of scrutiny, which is very elaborate blood work that's obtained in order to determine if any diseases are present that the mom may not even know she has. If you pass those both levels of scrutiny, these patients were moving to a scheduled C-section. So this kind of stem cell that I'm using is coming from a day that's planned because we've accepted the woman's donation. We have a date, we have a time. In the operating room on that day, the surgeon delivers the baby and presents the healthy baby to the pediatrician and off to the neonatal unit to go.
Everything is set up and prepared and
Right.
ready to go.
But then turns back to the patient and delivers the placenta and the cord. As you mentioned, had this donation not been given, they were going to be discarded as medical waste.
Mm-hmm.
But in this case, because the mom has said it's okay to use them for medical purposes, they are delivered and then handed off to the awaiting surgical team that was dispatched by the company that processes these cells, that quickly take the organs back to home base and within 4 hours of arrival process the stem cells from them, cryo them or freeze them until one day I call up and I say, please send me 2 vials, little 1 milliliter vials. Send me 2 vials, 3 vials, 5 vials. They pull from the freezer. They pack them in dry ice. FedEx picks them up and they're delivered to my office the next day.
Please explain to us what exactly is a stem cell.
So a stem cell is a blank cell that hasn't decided what it's going to be just yet.
So we medically call that an undifferentiated cell.
It's undifferentiated. And I shouldn't let that confuse anybody who's listening to us today, because every single one of us from the moment of our conception, our own conception, was a cluster of stem cells for about the first 3 weeks of our development. There was no differentiation of cells. They were all stem cells. But a certain point was reached in our development at about 4 to 5 weeks, where the embryological layers began to develop and cell lines began to be pursued. So a group of stem cells said, we're going to be the nervous system. And from that moment, when they made that declaration, they have moved down the pathway to become nervous tissue.
Is that accomplished by some chemical reaction?
That's DNA.
DNA. So
that's ultimately programmed through your DNA. But the fact that we all began as stem cells, I guess, is the point I want to make. We can now harvest these stem cells and give them back to ourselves. We can get them from ourselves, which used to be the way that this was done. That was called autologous. And for years.
So it was taken from where from ourselves?
Well, we became our own donors and our own recipients. So the two sources of autologous stem cell were either person's body fat or their bone marrow.
So body fat, especially from the belly area?
The abdominal girth was usually a good place. You have to harvest about 60 cc's of fat through a mini liposuction that you do. And then you have to expose those cells to 3 hours of a manipulation process, rather involved, to ultimately extract the stem cells from the fat. Those cells are what is given during the injection.
And then the other place is bone marrow.
Bone marrow.
Which is a little more extensive of a procedure.
Bone marrow usually done in hospitals. The fat usually done in office.
There's still some risk to doing both of those.
Yeah, and this is the way it was done whenever we first had stem cells make it to the marketplace in 2005.
Now, I know there's a problem with extracting stem cells from us and using them again as to replace our internals of our knee. We're going to take a quick break here. When we come back, Dr. Courtney, I'd like you to discuss why it's better to get these cells from the first procedure you talked about, the placenta and so forth, as opposed to taking our own stem cells.
Very good.
We'll be back in a couple of minutes at Healthy Pets, Healthy Owners with Dr. Dennis Courtney. Welcome back to Healthy Pets, Healthy Owners. I'm Dr. Edmund Sulkowski. And right before the break, we're here with Dr. Dennis Courtney talking about stem cells. But we were talking about the two types of stem cells that we have access to medically. One that's taken from ourselves and the one that we get from the placenta. Dennis, you were explaining those two terms and what the benefits of them are and what's the better way to go. So why, you started to talk about why it's better to get them from the placenta than from ourselves. Why is that the case?
Yeah, look, we all began where all stem cells were harvested through autologous means. When stem cells made it to the medical arena in about 2005, there was the only kind of stem cell that was available was derived through autologous means. Now, we did this for the longest time, but about 8 years ago, we moved to this other form, which are coming from the newly delivered babies by scheduled C-section. Literally, I believe, making any autologous form of stem cell obsolete. And I say this for this reason and this reason only, that by the time we were reaching our ages, advancing ages, we don't have any stem cells.
And I know from talking with you in the past, you say that stops around 15, 16 years of age.
I want to repeat that because it's almost amazing. After the age of 15, the stem cell level of any human being drops off so much, and from that point continues to drop off. But I mean, the drop off is tremendous. Who would ever think of a 15-year-old as over the hill in anything?
With stem cells, you are.
But when it comes to stem cells, it is. So for those who were early receivers of stem cells and got a good benefit, I'm happy for them. I'm enormously pleased that they got the benefit. Unfortunately, what I hear too often is I went and had that kind of stem cell done. You know, I got relief for about 6 months, a year, and then it went away. And this is not what I'm finding in the newer forms, which are homologous, not autologous.
And that's because the concentration, there are so many million of them, and they're in abundance.
A newborn is a seething bundle of stem cells. And they're vibrant, and they're energetic, and they are harvestable, and they are cryoable, meaning they can be frozen. And so the numbers of these cells in a newborn is so high. This is the source. Because the more the stem cells are, the more the number, the better the possibility of resolving the problem.
And so what happens when you, and I know the procedure is very simple because I personally know 8 people that have gone to see you and have had, and the gambit is kind of amazing. Most of them have been knees, but there have been hip and there have been shoulders.
And shoulders too.
So I know 1 person that did a hip and 2 people that have done shoulders. The rest have all been knees. Everyone got them the result. The shoulder, not the hip person is what I want to talk about. He called me up, a friend of mine, and he said, I'm going in next week for hip surgery. And I said, what's going on? He says, well, I got a bad hip. They need to replace the hip. And he's in his 70s. And he said, I said, did they tell you all the complications and all the possibilities of things that could happen down the road? For example, you go to get your teeth cleaned, you need to put on an antibiotic because that bacteria from the cleaning, as they're cleaning your teeth, can go right to that hip and cause the hip to fail. No, they never said anything like that. I said, did they tell you that if there's an issue, that they only last maybe 5 to 7 years, and you may be only eligible for 1 more replacement in your lifetime, and that's it? No, I never said that. I said, call your physician, ask them that question. He called me back within an hour and a half, said, yeah, now they tell me all that stuff. And I went, you need to call Dr. Courtney's office. I said, but the first thing you need to do is go to 101, and it just so happened that you were having your Stem Cells 101 lecture, which you do every month once a month on a Monday and evening, and it's a free lecture that you do. It's such an I've attended it. It's such an engaging lecture. You're not selling anybody anything. You're educating people so that they're armed and they can go to anybody and ask them about stem cells. Anybody in the Pittsburgh area that's doing stem cells. You're there to educate people. Hopefully they'll come to you because you were at the forefront. No one talked about stem cells here until you did. And now I'm starting to hear other people doing it, but you're still the, as far as I'm concerned, the main source in the Pittsburgh area for stem cells. You have the protocols and you have the recognition for stem cells as well. So he went to your lecture. He called me that night. It was about 9:30, 10 o'clock he called me, and your lecture is 7 o'clock in the evening, and he knows I go to bed early anyway, but he called me up and he says, I got an appointment with Dr. Courtney on Thursday. And he says to me the best thing that he ever did was going there and getting this done. Yeah. And he was out of pain and moving and so forth. He avoided that surgery. Now, surgery is to me always a last resort.
Should be.
You know, I like to tell this story when I have coffee with my friends and we're talking about some medical issues from time to time. One day I stepped out of the shower, slept on the ceramic towel, went down like on ice skates. I didn't fall hard because I grabbed the doorknob and it broke my fall, but I twisted my right knee. Now my right knee, Dennis, has had 6 surgeries on it. Medial meniscus surgery twice, broke my kneecap in half, injury. Had a pin, had the screw put in, had the screw taken out, was in a full body cast. It's a mess. I was told that I would have an artificial knee, blah, blah, blah. None of that's ever happened. In fact, when I was going into the Air Force and they had to exclude this knee, they couldn't find a fracture. And I've had no pain, no problem. But the first thing I did was call you, and I said, Dennis, I hurt my knee, I want stem cells. No, you said, wait it out and see, because it could be just a sprain and so forth. Well, it did after a while, no more symptoms. But my mindset was, I'm not running to the bone guys you mentioned
have a surgery.
And have surgeries, and I'm done with that. I'm looking at healing my knee the way our bodies are meant to do. But you're cautious with it. You didn't say, come in, Ed. We'll give you some stem cells. You said, see what happens with it. But I guarantee you that if I have a problem that occurs from this, because maybe that twist created another problem with all the damage that I've had in this knee.
One day,
I'll be knocking on that door saying, hey, Dr. Dennis Courtney, I need those stem cells, because I'm not doing surgery in my knee again. Yeah. And I have to, this is kind of a personal indirect endorsement. Every one of these people that I know, I followed. I asked them, was there pain with the injection? No, there was no pain whatsoever. I felt a little pressure. How soon did you start to feel a response from these stem cells? My friend who had the hip surgery said, I think it was psychological, but the second day I was out of pain. And I said, I don't think that was psychological. I think those were the stem cells doing what they were supposed to do. I know someone who held her arm down here. She's doing this with her arm.
Shoulder.
She had a shoulder problem. And she had one shoulder that had surgery a few years ago, and she can't do that with the surgical shoulder. But she's up like this with her other shoulder.
That's great for her.
Yeah. But but the first thing they told me that it was the pain that went away. And that's what drives them to the office, is pain.
You see why I enjoy what I do, Edmund, so much? The fact that you can influence severe issues so rapidly and definitively, making, as I think I did when we opened this show, I believe those surgeries, I mean, thank God in a way we've had them, because these orthopedic surgeons are brilliant at doing them. But what I've seen now, and I've got about 500 cases under my belt. It's quite a bit.
That is quite a bit.
So, knees and hips and shoulder now. No one's needed to have this surgery. Now, if you keep seeing this over and over again like I do, I need to pass that message on to a listener to say, if you're in any way in some difficulty, you need to check out stem cells. But please don't do it until you've come to a 101.
Because you're educating that 101. You send people away with a sheet of questions to ask any physician that's doing stem cells. And the funny thing is, I've talked to people who have done PRP, and they think they're getting stem cells.
No stem cells.
And there are no stem cells in PRP, but yet that's the misconception that they have.
And by the way, it's a great therapy. I've used it myself many times. Maybe you did too.
I did in my eyes, for my eyes.
But platelet-rich plasma, which is what we're talking about for the listener's sake, there are no stem cells. There are cytokines, growth factors, some nice healing properties. But I'm going to tell you, as we age, just like we don't have any stem cells, as we age, we don't have any PRP either.
Boy, this aging is a bugger, huh?
It's a bugger. So that depending on the age, PRP might be a very good treatment, but it is not stem cells. So just to pass that out there to our listeners, to educate them on that.
And that's why you do the education process. You do the 101 once a month, and you actually do it in Florida as well, because you have an office in Florida. So you're a busy man. I don't know. I'm always calling up Dennis and going, can you come on the radio program? Can you come on the TV program? Because I like you disseminating this information, because I see it personally helping people. And the more this is brought out to the public, because I believe that these stem cells it's the future of medicine. It's going to cure people.
It really will be. It will be. In the next decade, I think you're going to see what, to date, I think the last number I got from the FDA was that currently there are around 900 stem cell clinics in the United States. And I look at that as a very low number. Countrywide, 900. I think the day will come when there'll be 9,000, because the public, when they finally realize that there is a substitute for that surgery, are going to demand it. And there's so many that require surgical intervention that there'll be plenty of doctors that are helping to help.
So your focus is knee joint, hip, shoulder.
Well, that's what comes to me.
Can we use stem cells for other components of injury
I
or illness?
believe you should be looking at a stem cell can become any tissue. What makes the joints so appealing is that there's a capsule around them. And one needs only to enter the capsule, put these blank cells into the capsule, and they can't escape. So they're trapped in that knee or that hip or that shoulder. And now these blank cells randomly land on those 5 tissues that we talked about earlier that comprise the joint.
And regenerate them.
And upon landing, determined to be a brand new one of those, whatever that is.
So it's growing new bone, growing new cartilage.
Those that land on bone are going to become brand new bone. Likewise for the synovium, the cartilage, all 5 things. And after differentiating and declaring to be that cell line, never can go back. They will never be blank again. But every 3 to 6 weeks, they will double. So starting out at 10 million, 3 to 6 weeks later, we're talking 20 million, then 40, then 80. Enough critical mass finally gets reached where we literally regenerate a new and healthy joint. Only a healthy one, because the pathology, the arthritis, the very words that you were using to describe the diagnosis for that name, you have provided the pathology. But the code that gets read to repair this only knows one thing: your DNA.
So that's what it's replicating.
It's your DNA, which hasn't changed from the moment of your own conception till today.
So it never is going to replicate the disease.
Can't replicate pathology, can only replicate the actual structures.
If I have COPD or some lung issue, can I use stem cells in my lungs?
You mentioned something that's very much intrigued me, because lung disease is another one that actually we have a great opportunity to assist in. And the reason is, when you deliver these stem cells IV, no matter what vein you use, all veins dump into the mother vein called the vena cava. Vena cava is about the size of a garden hose and goes directly to the right side of the heart. And from the right side of the heart, where's it going, Edmund?
Right to the lung.
To the lung.
Well, it deposits some of the cells in the heart?
No. Look, that's all a free ride. Veins deliver blood to the heart and only send it to the lungs to be oxygenated because of carbon dioxide. But the fact that it's the delivery mechanism that makes this, the whole package goes to the one place you want it to. So you're talking about the 2 areas that I think have the best result. The joints, fill in the blank, and the lung, because we can deliver the entire package to the site that we need to have the work done. So in those cases that I've treated with COPD, I've had some amazing things happen in a very short period of time. Everybody in Pittsburgh knows about Al. I'm not going to get into Al too much, but he was the first to present to me requesting to do these stem cells IV. I thought he was crazy. I never heard of such a thing. But as it turned out, about 3 weeks after we did that to him, and that was in December of 2015, Al, who claimed that he couldn't make it from his couch to his refrigerator without needing puffs of his inhalers,
Steroid.
was now off all of his meds. Al was a pretty happy guy. And Pittsburgh knows Al because at that time, I had my radio shows. I had done them for a number of years. I brought him on the radio show. And Pittsburgh got a chance to talk to Al. Al, by the way, for those who know me, is still doing wonderful. I say this because anytime I'm in a supermarket and one of my patients sees me and says, "Hey, how you doing, Dr. Courtney? How you been?" They always say, "And by the way, how's Al?" Al's a rock star here in Pittsburgh because he did so well. But we've had 20 different Als now throughout the country, and they're pretty happy about themselves too. So joint and lung, I believe, are 2 areas.
And in the future, I know this from our discussions, these in the future, once we develop a delivery system, can take care of kidney, liver,
There's
heart.
not an organ in the body that really can't be regenerated, but we have to get to the point where we can deliver the entire package to only that site. So if somebody has a kidney, and I've had patients that are on transplant lists waiting for that kidney and asking me what to do, but I say the day that we can actually deliver all 10 million cells to that one kidney through the renal artery is the day we're actually going to be able to reverse that condition.
And kidney is a hard disease to reverse, kidney disease. So if I just wanted to feel good, would stem cells injected by IV make me feel better?
You know what? I've had many patients come to me. It's not an inordinate number, but what you've just described is what we refer to in my office as a spritz. Okay?
Spritz.
You're talking about a spritz, Dr. Edmund. And there have been people that come and ask for this IV and do get feelings of improvement throughout. These are generally people of advancing age who want to do something to rescue themselves. It's an oddity. I don't promote these things. I don't say think of doing a spritz, but other people who don't really have a particular one place to rescue ask if they can do a spritz, and they do it every year.
Wow. Let's change the focus slightly, but it's not unrelated. So I did PRP for my eye problem, and while I was doing PRP, it helped tremendously. Didn't last. After I stopped the PRP drops, it was gone. It was kind of a nuisance. I had to go draw blood. I had to take it to a pharmacy, have them spin it down, have it refrigerated, do the drops, thaw them out, do all this stuff. But it helped, and it was worth it. But it wasn't a cure-all. Can we do stem cells in the eye?
I do stem cells for the eye. I, as you know, treat very serious eye diseases. And my problem is that I have to use them IV, and I can't control or determine that all the cells are going to make it to the eye. So remember, when we give anything IV, it's all going to the lung, 100%. 60% of those cells will get trapped in the lung. 40% will make it out of the lung and come back to the left side of the heart. And from the left side of the heart now will be pumped out into the circulation through the aorta and literally be sent to every single organ in the body, every part of the body, in a random fashion.
We'll get something.
So everything gets something.
Even the brain?
Absolutely.
Because the eyes are the same tissue and everything as the brain.
But if you have an eye disease, you want the day where all the cells can be delivered to the eye and the eye alone through the ophthalmic artery. And it's going to require, we have the expertise to do it. There has to be a cath lab. We've got to insert a catheter in the groin like they do when they do a cardiac cath. But instead of turning left into the heart, go north a little further into the carotid. The carotid bifurcates into the internal and the external carotid, and the first branch off of the internal carotid is called the ophthalmic artery. These are what is going to be able to change the course of.
So you just described depositing those stem cells to the heart, with the same procedure.
Same thing. So we can rush through the heart.
Well, then you should be able to do that to the kidney as well.
If there were a code for it,
A billing
when
code.
you walk into a cath lab
Yeah.
and you turn on the switch, it's about $14,000 for you to turn the lights on in there. Super sophisticated equipment, personnel highly trained. Only people can afford that are the insurance companies, and they're not paying for a procedure without a code.
Yeah. Well, that's a whole nother
A whole
conversation.
other ball game there.
So not only do you have these educational platforms for Stem Cells 101, but you do that for your eye protocols because you have a very natural, holistic approach to treating eye diseases that occur in the back of the, because there's a big difference between eye disease in the front and eye disease in the back.
That's right.
And the back ones are really, there are, as far as I know, and I'm by no means an eye expert, there are no treatments for eye diseases in the back of the eye.
There's no. So diseases of the retina is what you're talking about. There's a whole host of these diseases that unfortunately we suffer as we advance in years. Names such as glaucoma, terrible disease. Number one cause of
Blindness.
total black blindness. Macular degeneration, whether it's wet or dry. Diabetic
That's
retinopathy.
bleeding in the eye, macular degeneration.
Wet macular
It's
degeneration is bleeding. Dry is not. Diabetic retinopathy, retinitis pigmentosa, the list goes on and on. Unfortunately, if it's a disease of the retina, there is no treatment in conventional world for it. So very intelligent and brilliant ophthalmologists can't use their skill set to help you in any way get your vision back. This is a blow to the gut of somebody who's diagnosed with glaucoma or MACD. Because I can tell you this, the disease is going to progress. One hopes it to be very slowly progressing, but if it should speed up, there's nothing in the conventional world to slow that down. And the person ends up, in the case of glaucoma,
Losing
total
eyesight.
black blindness. That is the point I want to make to our listeners, that is reversible, but you can't use anything conventional to treat it.
Because there is no conventional treatment.
Right. Surgery, drugs, procedures will not be able to fix it.
So you use certain nutrients and
There's
I
a
know
whole host of things that we've worked out. Dr. Kondrat,
another Pittsburgher.
a Pittsburgh ophthalmologist, developed a very famous 3-day program. My work with Ed has led me to the point where we do these programs in my office once a month.
And in Florida you have
and also in Florida.
And so it involves microcurrent technology.
There are a whole host of modalities that are used, none of which were ever taught to me in my medical school. Most of what I do in my office is not taught in
That's
medical
why we
school.
use the term out of the box, because
Out of the box.
the medical profession teaches you to be inside a box and
That's
you
right.
can't vary it.
That's the use of drugs, which
Yeah.
I already said we don't use.
Drugs and surgery, right? And so what you've done is you've taken your protocols and then you do the same thing as you do with the stem cells. You have, and this is every other month, you have your eye protocol seminars
That's right.
on a Tuesday evening.
That's the next day. So we invite people who have these serious eye diseases. We encourage them to get in touch with the loved one who is afflicted to come on out so they can learn about what can be done. Stem cells are a part of what can be done, but only after we do one of these 3-day programs.
So what you're doing with these educational programs, and I always tell people, bring a friend, because if you don't have the problem, you know somebody that does. And just become educated. Learn what's out there, because you don't hear that on mainstream anything.
Won't be hearing anything.
No. And so you want to be empowered, which is a term not to be used lightly, because it really can change the life of somebody.
Yeah, it does.
Somebody that can't walk or can't sleep because they're in pain, to someone who can't see. And the point of it is, your seminars are free. You don't charge anybody anything.
That's right.
And actually you give a break, because if they make an appointment with you, that first appointment is free.
I want to talk to them about their disease, they want to talk about their disease, we'll do that one-on-one, and we're not going to charge them for
So
it.
Dennis, we're at the end of this time here, and I just want to remind everybody that you can hear Dr. Courtney and actually call in and talk to him live on my program, Healthy Pets, Healthy People, AM 1250, on Saturday mornings at 9 o'clock. Dr. Courtney is usually on the first or second Saturday of that month. I kind of set that day aside for him to educate on that program and give you a chance to talk with him, so please tune into that. His stem cells, you can call his office, and I should know that number,
724-942-3002.
Yeah, and I think that information will be up on the screen along with your website. He's an asset of this area. We need to take advantage of him. I know he's my go-to person. So I thank you so much for watching Healthy Pets, Healthy Owners, and I thank you, Dennis, for coming on the show.
Thank you, Dr. Edmund, for inviting me.
Educate yourself and empower. Remember, a healthy pet is a happy pet. When you're healthy, you're happy as well. I don't know if you can come in and get a picture of Tucker here, because I didn't announce that Tucker was with me, but this is where Tucker got his name. If you can see what he's doing with his head. Can you see that? He's tucked under my arm over here. Thank you so much, everybody. We'll see you next time on Healthy Pets, Healthy Owners. Bye-bye.